This is an important day. I remember deep in the depths of COVID, walking in the corridors of Queens Hospital when the Delta variant was there and among us. They had 7 wards that were filled with individuals that were intubated or severely ill with COVID. And as we walked by one of the rooms, a woman came out in tears. Not an old woman, somewhere in her 50s. Tears gushing down her face, and we thought the worst for a moment, that she had just lost a loved one. Turns out the opposite had just happened. Her daughter had just been extubated. The breathing tube had just been taken out because she was now getting better. And the brave nurses at that particular hospital, Queens, had just helped her come through that process, and she was going to live. And I remember the look on the face of all of the nurses and the doctors, the respiratory therapists, just how much joy they had after watching her suffer. And that scene played out dozens and then hundreds and thousands of times over the course of the last 3 years. And so today I just want to say quickly, I salute all of the healthcare workers, all the people that sacrificed during the pandemic, the extraordinary people at the Department of Health who really put in so many hours to make sure that as few people passed away as possible. But it was those moments in the hospitals, like at Queens, over at Straub, all across our state, HHSC, Kaiser, where people lived because during those dark moments, when it was at its worst, when the virus was strongest, they stood fast. So that was an extraordinary thing. So I mahalo Governor Ige, who helped get us through this pandemic, along with other people. There have been new mayors, and there was Mayor Caldwell. And, like Kenny said, other directors of health, epidemiologists, people who sacrificed greatly. And it was a really great challenge for all of us. So we mahalo everyone for understanding that this was a tough time. Now on the whiteboard, we wrote the number 4479 at the top. 4479 was the number of fatalities that we expected per year had we not intervened. Had we not fought to make people mask up, to get vaccinated when the opportunity came, to socially distance, to stay home sometimes, to stay away from school. 4,479 people we expected to die each year if we didn't take action. And so what you did as a people in our culture to make sure we didn't spread the virus to our loved ones, or at the workplace, or at schools, that's what saved lives. So we thank you. In the end, more people in Hawaii got vaccinated than almost any other state. The number was 78.7%, got those first 2 vaccinations, which really made it safer to live. In the end, we did not see 4,479 people die. Far fewer passed away. And each life we lost was heartbreaking. Every story broke our heart. But to imagine that over 3 years, more than 12,000 people could have passed if no action was taken is an extraordinary testament to what people in Hawaii are and the values that we have when we care for our ohana. We had the lowest mortality rate in the country. And everywhere I go, when I talk to other governors, when I talk to the president, when I talk to directors of health or other strong leaders in health, they look at Hawaii and they're astounded at what this Department of Health did, what the people of Hawaii did, what the doctors and nurses and all the rest of you did to get us through. So I just say mahalo. Mahalo as your governor for making sure that we really put our love for one another ahead of all other challenges. Even in our times of conflict, at the end of the day, we looked out for one another. So I want to say you've been extraordinary. I'm going to turn this now over to one of our additional experts, but it really was something that we will never forget, and it made us stronger and brought us together more closely than we could have imagined. Aloha.